Welcome back, ladies and gentlemen. I'm broadcasting from my home this evening. All is well with me, but some of my colleagues, some of my friends at work are not. And as part of our test, track and treat methodology that we are very, very strict about within Network 18, I'm working from home till the time I test myself again, and then I can come back into the studios. Is it tough? It is. Is it difficult? It is. Is it irritating? It is. But is it the right thing to do? Yes, it is. It is for the safety and well-being for all of us that we are doing this. And I thank our network for being very, very rigid about these protocols for the safety of the employees. Another request, ladies and gentlemen, hashtag Lagaya Kya. Just put vaccine and mask as a prefix and always answer these questions. If you're eligible for the vaccine, please go and get it. Otherwise, encourage and make sure that those who are eligible do get vaccinated. And anybody and everybody, the moment you step outside, make sure you don't show me your face. Mask Pehno India is the hashtag tonight. And here is the reason why. Have a look at this John Hopkins report, ladies and gentlemen. This report very clearly shows Brazil, UK, US and us. Look at that steep spike. That spike is alarming because that spike is higher than what we witnessed when we were at the peak in wave 1 sometime in September. Have a look at these numbers. Our research team has pulled this out. India's COVID wave and COVID blues. The first wave, the peak was around 16th of September 2020. We had 97,894 cases in a day. Today, on the 12th of April 2021, amid the second wave, we've registered 1,68,912 cases in the last 24 hours. 74% of the cases came from 10 states in wave 1. 83% of the caseload comes from the same 10 states in wave 2. The straightforward question that we are asking is, can we afford to have another lockdown? Can India afford another lockdown? Or is it high time that we pick up the pace on test, track and treat, and more importantly, start adhering to those COVID protocols rigidly, even as the vaccination is on? Let's go straight across to our guests. The hashtag is Mask Pehno India. And that's a simple, straightforward appeal. Don't show me your face is another hashtag which we are pushing on the network. Mask Pehno India is what we are urging. Let's go across. Dr. Narendra Kumar Mehra, former Dean, All India Institute of Medical Sciences, ICMR National Chair with us. Niranjan Hiranandani ji, NAREDCO President, is also with us. Sunil Alag, SK Advisors Chairman, is with us. And Dr. Rajesh Parekh, Director Medical Research, Jaslok Hospital and Research Center, Mumbai. He's also the author of the book called The Coronavirus, which he wrote around the time when we were dealing with the first wave. Everybody was coming to grips with this virus. But we are, a year down the line, Sunil Alag, far, far more prepared. We are, a year down the line, at a nation which brought down to these cases to about 1.25 lakh. And today, we are staring at 1.1 million cases. So where are we going wrong?
Where we are going wrong right now is the fact that everybody became very complacent. So did our leaders when they are holding these rallies, and so did the people. We became very, very complacent. We opened up and we thought everything is over. See, the trouble with us is that our DNA is that if you prevent any Indian from going out, and I was reading it in one of the SMSs that came to me, you tell them not to go out, 40 guys will go out to just see who else is being allowed to go out. So that's what we have to change as a people. And there has to be a balance now between the leaders in election rallies. They are going ahead and campaigning. And whether it's any political party, whether it's the TMC, Congress, BJP, anyone, all of them have to get together. And this is what we look up to. If they can do it, why not us, is the natural reaction of most people. And as far as I'm concerned, a balance now has to, where leaders will take and say, look, we are doing it, why not you? And the people have to stop taking everything in a complacent fashion and follow all the rules. In Bombay, for instance, or Mumbai, as we call it now, I mean, you've got everybody going around with masks because there is a danda on their head right now and says that if you don't do it, we are going to have a lockdown. We cannot afford another lockdown at all. We have to follow the rules, and so do the leaders whom we look up to. As far as I'm concerned, look, it's very, very important right now that we do micro-analysis, and the center must let go of a number of things and the chief ministers to say that, look, most of the people are between 25 to 44 in Mumbai and Pune who've had this rise in COVID cases. You don't have to go and do a macro thing and the Chief Minister must not say all of Maharashtra above 25 has to be inoculated. What we have to say is in Mumbai, in certain areas, please allow us to do it. And the center must give the freedom to the chief ministers to do in micro analysis in each area and go ahead and give the vaccination.
Yeah, but the fact of the matter is that's the problem. Now, I just have my mask even at home. I carry it with me just in case there are visitors and people are there. The thing is, this mask is worn here.
No,
Everybody wears a mask here.
Yeah,
mask क्या फायदा? ये दाढ़ी में under the chin. That's where the mask is. Mask है, हाँ है. And you ask somebody mask है, then it goes up. Otherwise, it is here, or it is here, or it is here. What's the point of this mask? That is one serious issue that everybody has. The other thing, Dr. Narendra Kumar Mehra, across the world, below 40 vaccination is not yet being recommended by the WHO. So why are we pushing for vaccinating those between 25 and 40, especially or 44, especially when they are the ability, natural ability to beat this virus unless they have an underlying comorbidity? Is it because of the vaccine? Because when the vaccine was not there, we had brought down the cases to 1.25 lakh.
I agree with you, Anand. I think what worked last time during the first wave would also work in the second wave. We have to be very careful of the fact that we are now also seeing new mutations as well. After all, India has now seen the second, India has seen the double mutation as well. Double in the sense that there is a 484 and there is a 452. 484 is like what we see in South Africa. 452 is also seen in certain viruses over there. But to see them two together is for the first time in India. Is that driving the more and more infections there? Perhaps yes. So we have to be careful. I am totally against the total lockdown because we have seen in the first wave that the lockdown was really not very, very good. I would say disastrous. So we might have to use other ways like the night curfew or what we call the corona curfew. We could even do, restrict the number of travelers from one state to the other because we do not know as yet. The data is not yet clear on where do these double mutations are found. We know for certain that they are found more commonly in Maharashtra. And we also know that the world data, and they are actually have been seen in at least 8 states of India, or maybe even more. But the most number of double mutants that we have seen are from India, nowhere else. And I think India is followed by the UK over there. And these are the only 2 countries they're seeing. And this particular mutation, the one that was
I'm looking at some parallels. Some aspects which come to the fore. Yes, we cannot afford a lockdown because economically we just cannot afford to be in a position like that. But then why are these similarities? There were 130 red zone districts, as I bring in Dr. Parekh and also Niranjan Hiranandani ji. Maharashtra is the worst hit state in both the cases, first wave and second wave. Look at the similarities. 7 out of the 10 states among the top 10 in both the waves. Delhi, the 8th worst hit state to 3rd worst hit state from wave 1 to wave 2. Chhattisgarh, 10th worst hit state to 4th worst hit state. 6 of the 10 district hotspots are again there in the second wave. Pune, Mumbai, Thane, Bengaluru, urban top 4 hotspots again. Ab Niranjan Hiranandani ji, please tell me, this cannot be blamed on vaccine shortage or vaccination. This has to be because of lack of testing, tracking, treating and COVID protocols not being followed. Imagine what it's going to do in terms of economic activity. All those migrants who trudged along on the streets and became a huge issue, they came back. Now they are again flocking back towards the bus depots and to the railway stations. Pata nahi Maharashtra mein kya hone wala.
Anand, you are absolutely correct. We just can't afford a total lockdown like we had done last time. And having the workers to go back would be criminal. I think they have to be very careful to see that the economic activities in terms of areas like we have talked about construction, with people working in situ, factory workers who are living within the premises or next to the premises, other areas and segments where we should be able to get the work continued in spite of everything. I think we have got enough information and data by which we can say that you don't need 100% knockdown because the economic loss of a total lockdown is going to be very tough. However, there is another problem which we are facing as far as Maharashtra and Mumbai is concerned. We have a shortage of hospital beds, we have a shortage of oxygen, we have a shortage of medicine, and this part of it is actually requires to be there. So we may do need a partial lockdown that may be necessary for us to catch up with all these poor activities which need to be put back into place. But economic loss of the poorest of the poor, believe you me, we cannot afford to see it again. I mean, we have seen it before, and it's just horrible. So we have to be very cautious before a full lockdown is definitely not the right thing to do. But yes, a partial lockdown in order to slow this entire matter while we catch up again. On the vaccine issue, I think there's a failure. I think
Dr.
you're undermining
Dr.
vaccine,
sorry,
but I don't agree
if
with
I
you
may,
at
sir.
all. I don't agree with you when you say that vaccine was not there. It's like saying one medicine was not there last year, so why do you need it this year? That's not correct. If you have the medicine, you should have provided fully for it, and by now you should have got everybody vaccinated. I run a hospital. It's very, very clear that the mortality for people who have taken vaccine is almost zero. Mortality I'm talking about. It's not that you don't catch it. So not having got vaccinated is a criminal matter. And we need to improve the vaccinating positions completely. And certainly above 24, we should vaccinate, especially in dense areas. You were asking why Maharashtra? Maharashtra is a very dense place. Come and see what is the place we have in Dharavi. Look at the places which we have in slum. 50% of my population lives in Jhopatpattis in Mumbai. Obviously, the spread is going to be more. But we have solutions for it, and I'm sure with a partial lockdown that we really need to do in order to catch up with these four matters, we should be able to get it there. But one more thing,
sir, but the argument very
years ago. I attended Kumbh Mela 2 years ago, but at this point of time, I think more this Kumbh Mela which has taken place is certainly a wrong activity which has taken place from a health perspective, and of course the elections issues where you are getting crowds together. I think
I totally agree. Even if the DM is saying that the attendance is 50% from the last time, and then they are sanitizing the ghats between akhadas and all, why this crowd? We railroaded and we criticized the Tablighi Jamaat for what they did at the Markaz the last time around. Why allow a Kumbh Mela this time around? Why allow political rallies in such a way that the Election Commission takes no cognizance of the brazen flouting of rules? And on the other hand, Dr. Rajesh Parekh, those who are least vulnerable or perhaps the most effective to fight this virus, who will recover in 2 or 3 days, and unless they have an underlying comorbidity or a very critical illness, show no issues, complications, that is those who are under 20, we are punishing them. Exams are cancelled, classes are cancelled, schools are cancelled. Every state first says school band kar do. Every state first says college band kar do. But who's carrying the caseload? Where is the mortality? On all those who are 40 plus. उनको घूमने दो भाई. क्यों दुकानें चलनी चाहिए? क्यों फैक्ट्री चलना चाहिए? क्यों businesses चलना चाहिए? Everything else. So there, what is the logic here then?
So, Anand, there are several questions within that, but let's get done with the most controversial of the lot first, and that's the dreaded L word, which is lockdown. And, you ask, can we afford it? Well, if you're talking in a linear, uncomplicated manner and purely in economic terms, it's a rhetorical question. I mean, it's a no-brainer. We cannot afford it. The question really is, how many options do we have at this point in time? It is like the decision to amputate part of somebody's body. If you ask somebody, should you amputate? Of course not. But suppose there's a gangrene that is spreading through the body. There comes a point quite often when you do have to take a decision as to which is going to cause the least harm. It's a cruel choice. It's, like William Styron's Sophie's choice. She had to choose between one of her 2 children when she was being sent off to Auschwitz. So, yes, as long as we have the luxury of options, nobody wants a lockdown. But, I fear we are running out of those options. And then if you have to make a choice between, millions of people dying and an economic lockdown, we may run out of those options. What can we do today? And your question about the stratification for vaccination, why why should young people have to suffer? Well, Anand, some time ago I was asked, last year actually, a long time ago, I was asked that there are so many different people who have different opinions, and particularly on a panel like yours where you've got people from diverse backgrounds. And somebody asked me, is it akin to the old parable of the 6 blind men and the elephant? And I said, it's a little more than that. It's 6 blind men chasing an elephant, which is not stationary, and which is changing its shape all the time, becoming a lion, becoming a tiger. So it's a very dynamic situation, and we are always 2 steps behind the virus. We have to accept that in humility. So today, actually, we should be using the word virus in its plural sense, because the different mutant strains of the virus, the ones that we at least know of at this point, are behaving differently.
Yeah,
some of them, or at least one of them, is dodging antibodies. One of them is resistant to medication. Sorry, you were saying something.
No, but Dr. Saab, what I'm trying to say is, sir, these antibodies, these viruses, these mutations, and I'm going back to Dr. Niranjan Hiranandani, because you're an entrepreneur, you're also running a hospital, so you're a doctor, you understand this. I'm just saying the patients who come with mortality, the patients who are suffering mortality are those who are out there, who are getting most affected by these mutants. उनको आप घर पे नहीं बिठा रहे हैं, उनको नहीं कहा है. Nobody is being asked. Businesses are saying we want to continue to operate, but schools, children, they will not be allowed to open. There is a lopsided understanding of this entire dynamic altogether. What I was trying to say is that I'm not saying that there should not be any vaccination. We have now reached 10 crore vaccination, faster than any other nation. But even if we continue to do at 40 lakh vaccinations a day, we will take at least another year to vaccinate our entire population, let's say above 18 years old. It's going to take us time. We know that. But my point, sir, is, are we looking at it the wrong way? Why is it that Mumbai is suffering with beds? Because 6 months ago, 8 months ago, we were not prepared. But 1 year down the line, we should have been prepared. We should have been ready. Who let down the guard? Who allowed this? Who allowed a contained virus to spread again? Where is that accountability?
I think the issues are manifold. It is no point in putting a blame game on what has happened and what has gone wrong. What we need is that we need to get the vaccination back to full speed, to get everybody vaccinated. We need to get the beds there. We need to get the oxygen there.
Right.
We need to get everything done within the next 7 to 10 to 15 days. All the talk we are talking about, who's fault finding, what is happening. What is disturbing is that the present situation with politicking, with the Kumbh Mela, with situations like that, the leadership is showing us the wrong direction. That is my problem.
Right.
If the leadership themselves don't wear masks,
I agree, sir.
They themselves don't do it, why will the people, the common people do it? If they are going to see that people can collect and do whatever they want to do, how do you expect the general run of the people and ordinary people? They are the kind of leaders who are there. So my worry is not about the issue of whatever we did wrong. Okay, we did it yesterday. Can we do it properly and finish it today? Get it cracking, and we want
sir. I'll take this conversation forward tomorrow. I'll take this conversation forward tomorrow. With due respect to all my panelists, I've run out of time here on this edition of The Right Stand. Zaka is ready with brass tacks. Stay with us.